Sarcoidosis is an inflammatory disease that affects multiple organs in the body, but mostly the lungs and lymph glands. In people with sarcoidosis, abnormal masses or nodules called granulomas consisting of inflamed tissues form in certain organs of the body. These granulomas may alter the normal structure and possibly the function of the affected organs. Sarcoidosis affects people of all ages, ethnic backgrounds, nationalities, and both genders. Currently, there is no known cure. The age group most likely affected is between 20 and 40. And while the disease can show up in any organ, the liver, the kidney, the brain, for example, the lungs are often the most prominent target. Sarcoidosis, however, is not contagious nor hereditary.
I'm Dr. Raj Gupta, and I'm actually a board-certified pulmonologist, critical care, and I do sleep medicine. And one of my passions out there is helping people with sarcoidosis. I actually work at USC, the University of Southern California, and I'm the Assistant Program Director for Internal Medicine. Excited to be here today and talk about sarcoid to everyone. What causes sarcoidosis? Now that is the question, isn't it? Well, the answer is we don't know, and that's why we need the research. That's why we need to talk about it. So when we talk about sarcoid, there's different parts when we talk about the cause, the etiology. Number one, who's susceptible to it? Who gets it? So the answer is genetics. They're trying to find out who is going to be predisposed. Is it a certain race? Is it a certain gender? And that's a big question. And just because we know the genetics behind it, which we don't just yet, are there triggers? What triggers this inflammation happening in the body? So some of those triggers could be the environment, and we don't know exactly what those environmental exposures are. The question is it our occupation? Are we working something that's causing us to rev up that immune system? And more importantly than that, let's talk about the word infections. And there are a couple infections that people with sarcoid know that we're trying to piece together. Certain bacteria, let me throw out the word tuberculosis, certain fungal infections, and even viruses. So it would be nice to kind of narrow it down a little bit. And you know what's a hot topic when we talk about sarcoid? Is it autoimmune? Because quite commonly when we talk about sarcoid, we involve a rheumatologist who deals with many other autoimmune diseases such as rheumatoid arthritis or lupus. And sometimes sarcoid gets clumped into that. You know why? We use the same immunosuppressive medications that we do sometimes with other types of autoimmune diseases. So we need to get to the bottom of this to help more people out. So that is a great opening question. What causes sarcoid? Well, a common question people asking me is, Dr. Raj, how do I know if I have sarcoidosis? And the answer is, you don't. And that's the scary part about it. Because sarcoid falls under this broad thing we call a mimicker. It mimics many different diseases. And sometimes it could be asymptomatic, meaning you have no symptoms. It's found by accident, getting that chest x-ray for a total other reason. But when we talk about how does it present, you tell me the organ and I'll tell you the symptoms. Because the sad part is, sarcoid affects every single bone, organ, muscle in your body if it wants to. The reason why I'm talking about it is because I'm a lung doctor, and you know what? Guess what organ sarcoid affects the most? You got it. It's the lungs. But you know what the interesting part is that if I were to ask you what doctor was the first one to identify sarcoid, it was a dermatologist, because sarcoid loves the skin. And if I want to speak a little medical lingo a little bit, that sarcoid can cause lesions known as erythema nodosum. When we talk about sarcoid, it can cause scars and papules and granulomas all over the skin. So that's one of our biggest organs. It can affect the eyes. It can affect the heart. It can affect the brain. And the reason why I'm mentioning this is because in order to be a good sarcoid doctor, we need to interact with our other subspecialties. But to answer your question, the lung is going to be the biggest culprit when we talk about our sarcoid patients.
Dr. Michelle Kulai. I am a practicing clinical rheumatologist and also assistant professor of clinical medicine at Keck School of Medicine of USC. And I'm really happy to be here today to be talking about sarcoidosis, to help patients to understand it better, to increase awareness about the disease. Patients that have sarcoidosis, only about 10 to 15% of the time do we see joint involvement as a cause of as etiology of the disease. And so the important thing is that when someone comes with joint pains, we have to look at other causes of joint pain also. And determining that the joint pain is because of sarcoidosis is something that can be complex sometimes. It can be difficult. And we have to look at things such as the type of symptoms that someone's having. We have to look at the joint exam. We have to look at relevant labs and relevant imaging studies. And so it can definitely be complicated sometimes. So the other important thing is that we do see joint involvement and bone involvement in sarcoidosis, but we have to also think about most of the time the bone and joint involvement that we see is due to the medications that we give, such as prednisone. And prednisone is a medication that reduces inflammation in the joints, but is also can have long-term side effects, and that includes affecting the bone and the joints over time. So can abdominal pain occur in sarcoidosis? Absolutely, the short answer. Now remember that sarcoidosis, so it's a disorder that causes clusters of abnormal tissue to occur in the body. And these clusters of abnormal tissue, these are called granulomas. And these granulomas can affect any organ system. And when they do affect the organ systems, then it can lead to these particular organ systems not working properly. So any part of the GI tract, the gastrointestinal tract, can be affected by sarcoidosis. And when these granulomas, they line the stomach, it can definitely cause abdominal pain. It can be dull, it can be crampy, it can be sharp. And so patients can even have nausea or vomiting. Now, the important thing to remember in someone that has abdominal pain and sarcoidosis is we can't forget about the other common causes of abdominal pain that are not due to sarcoidosis. So I think it's important that we have to make sure that we think about all of the many non-sarcoidosis causes of abdominal pain, and that people should go through the appropriate testing to do so.
The phenomena of these massive concentrations has been identified as the vehicle of inflammation. When granulomas appear in mass concentrations at any one spot on the body or inside, they cause excruciating pain. To have sarcoidosis, sufferers today are subject to various treatments and surgeries designed to help relieve the pain of muscle aches, fatigue, fever, swollen skin tissue, or shortness of breath. Today in America, according to medical science, symptom treatment or pain relief is primarily the only option available to sufferers. In the most severe cases, especially those involving the lungs, a lung transplant is possible.
What are the symptoms of the lung? I know I mentioned it already, but it could be as simple as cough. And you know what? Let me take that word back, simple. Cough is never that easy to work up. And the hardest part about having sarcoid is that, are my symptoms from sarcoid or are common things common? Because if I have a patient that comes to me and says, you know what, Dr. Raj, I have a chronic cough. You know what comes to my mind first is that maybe you have heartburn. We call that reflux. Maybe you have some post-nasal drip. Maybe you're an asthmatic. But the same token, if you carry a diagnosis of sarcoid, is that going to be the flare-up? So to actually kind of put the puzzle pieces together, to narrow it down to sarcoid, it takes some time, some studies, and patience to really say what the cause is. So in the lung, I think about cough. In the lung, I think about wheezing. And that's why we have to use medications known as bronchodilators to help our patients out. That's why sarcoid initially gets confused for other diseases, such as what? Such as asthma. Maybe sometimes if you had a history of smoking, something like COPD. So not only can it cause cough and wheezing, well, sometimes, depending upon where it is in the lung, well, you might even get some chest discomfort. So it depends. But I'm glad we're focusing on this because this is why many patients come see me, and this is why we treat them with medications, is because of these lung symptoms. And of course, how can I even not say this? Shortness of breath. it can be very, very debilitating. And let me be more specific. It's not being short of breath when we're sitting down. It's shortness of breath when you're exerting yourself, when you're walking those stairs. And that's why you always have to ask about your activities of daily living. Can you function? And in some individuals, it can be very, very tough. So what is the incidence of chest pain? You're just reading my mind. We're focusing on the lungs. I love this already. So this is going to be a little atypical. So sarcoid in general is what we call an orphan disease because, I hate to say it, not many people have it, and that's good. But when you do meet these patients, it's sad because when you go to a group and you get to meet these people, sarcoid is not as rare as you think at the same token. But chest pain is not the usual way people will present. In fact, let me just throw out some pearls. Dr. Raj will say, what is the most common symptom of sarcoid? And the answer isn't chest pain, the answer is fatigue. And that is the toughest symptom. You know why? What lab test do you order for fatigue? What x-ray are you going to order to evaluate fatigue? And that's where patients with sarcoid are going to be on medications to help out with that. And you know, going back to my earlier statement, when we talk about fatigue, it's so hard to figure out, is it from other things? Is it from their sleep at night? Is it from being anemic, or is it from the sarcoid itself? And this is where you have to put those puzzle pieces together to come down to it. But when we talk about chest pain, because I don't want to avoid this question at all, is that yes, people can have it. Especially I'm worried about if sarcoid is affecting the heart, or maybe sarcoid is causing you to have these inflammatory granulomas in areas in the chest that could be affecting nerves. So the answer is, sarcoid is a mimicker. It can cause many things. It's tricky. So if you have a symptom, lung, skin, eye, stomach, be sure to mention it to your doctor because you never know, especially if you carry the diagnosis of sarcoid.
Effect of sarcoidosis on the nervous system. So sarcoidosis only affects the nervous system about 5 to 10% of the time. Now when it does affect the nervous system, it can affect any part of the nervous system, whether it's the brain or the spinal cord or the peripheral nerves. And patients can have any variety of symptoms, whether it's numbness, whether it's tingling, whether it's weakness, and sometimes people don't even have symptoms at all. And so that's important to be aware of. Now, the other important thing is that we give a lot of immunosuppressive medications as part of the treatment for sarcoidosis. And these medications can have side effects themselves. And so whenever anybody has sarcoidosis and has new symptoms, not only do we have to think about, well, is it the sarcoidosis, number one? Number two, is it a side effect of the medications that we're giving to the patient, particularly infections. So I think that's also important to note. So can sarcoidosis cause fatigue? Absolutely. So fatigue is one of the most very common symptoms in anybody with chronic illness, not just sarcoidosis. We see this very frequently. And it's important to note that not only can sarcoidosis cause fatigue, but also there's a lot of other associated conditions in anybody that has a chronic illness. So whether it's depression or anxiety or insomnia, and all of these factor in very much into to addressing the fatigue in someone with sarcoidosis.
Is sarcoidosis a form of lung cancer? Let's go back to the beginning in making a diagnosis. So like I said, many people could have sarcoid and be asymptomatic. They don't know it. But suddenly they'll get an x-ray, a CT, an image of the chest of some kind, and what do you see? You see a word nodule. And anytime you mention the word nodule to someone in society, a patient, hey, you have a nodule. You know what they think about first? They don't think about sarcoid, they think about cancer. I would. And sarcoid loves to affect certain parts of the lung, like those lymph nodes. It likes to present like a nodule and sometimes even a mass. And especially if that patient has a history of smoking somewhere, even if it's only for 1 year or 1 month, you always have to worry about cancer. And that's why we have to be very diligent about getting tissue, meaning we have to get the biopsy. In fact, let me just say, how do we diagnose sarcoid? one of the biggest puzzle pieces we're talking about is getting that tissue and making sure we're not missing cancer. Cancer such as lymphoma, make sure we're not missing infections. Going back to what I said earlier in this video is that there are certain infections that can mimic sarcoid, like tuberculosis. So the answer is sarcoid is not cancer, but we have to make sure we don't miss it. All right, so this is kind of like playing off my cancer question. What does sarcoid do to the lymph nodes? So when we talk about our lymph nodes, they're very, very important in the body. They help us fight infections. And a lot of our white blood cells goes to these lymph nodes. So sarcoid, which is going to be a hyperinflection of all these immune cells like monocytes, like macrophages, and they form these granulomas everywhere in the body, but you could also get lymph node involvement, which is why when you have large lymph nodes, of course, cancer goes in the back of my mind, infections goes in my mind, but sarcoid loves to go there. And that's why if you're getting a workup and they're getting a CT scan or an X-ray, very commonly you will see enlarged lymph nodes on imaging and even on physical exam. When you see your doctor, he could be feeling for lymph nodes around the neck because it could involve it. Sarcoid loves to involve your immune system. Maybe not the most common thing, but it can even go to places like the bone marrow. It can go to places like the spleen, and all these things, including lymph nodes, helps you fight infection. And let me just go a little off topic and say that's the hardest part about having sarcoid is because having sarcoid can suppress your immune system, and you know what's even worse? When we treat you appropriately with things like prednisone, which are steroids, things like methotrexate to help out, they further will weaken your immune system, and my patients with sarcoid are predisposed to infection. So it's kind of like a double-edged sword. You need these medications, but you're immunosuppressing our patients, so it's always going to be about that balance.
So what part does stress play in a relapse of sarcoidosis? So stress can cause flares of any chronic illness, particularly sarcoidosis. And when we talk about stress, there are different types of stress. So there's physical stress. So when someone just has a surgery, that's a major stress on the body. Number two, psychological stress. So the stresses that cause anxiety, depression, and all of those things. And so whether it's physical or psychological, both of those stressors can definitely lead to flares of the sarcoidosis. So what are the different treatments available for sarcoidosis? So sarcoidosis, because this is an illness that is not completely understood in terms of the cause, the treatments really are geared towards alleviating inflammation. There's not necessarily going to be one cure or one particular treatment. Now, when we talk about treatment, there's several key medications to mention. So number one are going to be glucocorticoids. So these are steroids such as prednisone. And this is really the hallmark of treatment for sarcoidosis and really first line treatment. And typically patients are on between 6 to 12 months of therapy with prednisone. And sometimes this is really all that they need in order to decrease the inflammation, to decrease the size of the granulomas. And we have to remember, very important with the glucocorticoids of prednisone, the long-term side effects. And so this includes weakening of the bones. This includes developing diabetes, high blood pressure, cataracts. All these things are real. We really do see them. And so that's why we really try and limit as much as possible the dosages of the steroids and taper them as soon as we can. So that's number one. Number two is a medication called methotrexate. So this is an immune suppressing medication. It's a medication that decreases inflammation in the body. This is a medication that's weekly, and we do need to monitor lab testing frequently while on this medication. So that's a second one. There's various other immune suppressant medications that can be sometimes given in order to help reduce the dose of the prednisone that's given. The one that's really worthwhile to mention are these medications called TNF inhibitors, also known as biologic agents, and these are really becoming very popular. in treatment for sarcoidosis. And there typically, a lot of the research was done on treatment for rheumatoid arthritis, but we've been noticing that patients with sarcoidosis that have really aggressive disease, or if they have disease that's failed traditional treatments, they've had really good responses with these biologic agents.
In many people with sarcoidosis, the disease appears briefly and then disappears without the person even knowing they have the disease. 20% to 30% of people have some permanent lung damage. For a small number of people, sarcoidosis is a chronic condition. In some people, the disease may result in the deterioration of the affected organ. Rarely can sarcoidosis be fatal. Death usually is the result of complications with the lungs, heart, or brain.
The one thing that sticks out in my mind, my message to all my patients, is that the search is not over. It's just beginning, and we are discovering new things every day. It's a group meeting that we use all of our subspecialists, the cardiologists, the rheumatologists, and the pulmonologists to work together to make you feel better. I'm Dr. Raj, educating you today for a better outcome tomorrow.
Away from this video with sarcoidosis is that sarcoidosis is a chronic illness that, although we don't have a cure for it, we have a lot of available treatments, number one. Number two, very important, is that many patients do very well having the illness, meaning that either their illness regresses on its own or it does not progress. So that's important to mention. The other thing that's important to mention is that very rarely do people die from sarcoidosis. The death rate is less than 5%, which is very low. The cases where people do die, it's from conditions such as progressive lung scarring. So when the sarcoidosis very aggressively affects the lungs, sometimes can affect the right side of the heart. And sometimes when we do see sarcoidosis rarely affecting the heart, that can make patients very, very sick.